All right, a recall has been issued for a certain textured breast implant linked to a rare cancer. The move comes after the U.S. Food and Drug Administration and its manufactured Allergan has to recall a product. So the FDA says out of 33 deaths involving specific cancer, 12 out of 13 patients who knew what kind of implant they had Allergan. So board-certified plastic surgeon Dr. John Paul Tutela is here to join us to tell us all the scoop. Okay, what is happening, doctor?
Yeah, so the FDA issued this recall, and it's for specifically Allergan textured implants, and it's to stop using them moving forward. It's not suggesting that you have these implants removed if you already have them in, but it's just alerting the public to know what are the signs and symptoms of this particular disease. So it's BIA-ALCL, which is a type of lymphoma, and what people need to look out for who have implants in is, a change in their breast, either a change in size, swelling, or a lump, and if that does occur, that they should immediately consult with a board-certified plastic surgeon.
So if there are people watching right now and they've had the kind of implant, what should they do? Just keep an eye out for... Cause if I had this, I would be totally panicking about it.
Yeah, well, so, like I said, there's no, call for people who have these implants in to have them removed. The risk is very low, about 1 in 30,000 or even up to 1 in 4,000 people, which really translates into a 0.0025% risk. So it's a very low risk. And again, it's only associated with textured implants. It's not been known or recorded in any patients who have had smooth implants alone. So very low risk, but everybody should be aware. And again, if you do have any symptoms, swelling in your breast, any lump, change in size or shape, that you should immediately consult with a plastic surgeon.
So for our viewers at home who have had a breast augmentation in the past, where should they look to find out if they have these implants in? And is there like a certain time frame? Like if you got them in between 99 and 2006, these were the implants. Like how do you figure it out?
Sure. I would start with contacting your plastic surgeon. They should have a record of the exact implant you have, what it was made of, whether there's any texturing. They usually even record the serial number on the implant. And a lot of times even at the time of your surgery, they usually give you a little card to go home with the details of the implant.
Okay, most important question. Is this going to cost me money if I have these implants, or do I get them fixed for free?
Yeah, so if you have these implants and you have a diagnosis, so if you've had these symptoms and you went through the workup and now you're diagnosed with breast implant-associated ALCL, your insurance should cover it. If not, our two major societies, the American Society of Plastic Surgeons and the American Society of Aesthetic Plastic Surgery, they've actually set up a fund and a grant to help underinsured and non-insured patients get treatment.
I feel like over the past couple of years, we've had lots of stories about breast implants, whether it causes some sort of chronic fatigue, whatever it might be, like celebrities have been discussing this. A very generic question, but something that kind of, are breast implants dangerous now? Like, we know so much more about the health risks that can come from them.
Sure. I would say in general that they are not dangerous, that they're safe to use and safe to have implanted. I think the big thing is always, knowledge, and knowledge is power, and to empower patients and women by knowing what the risks are and making sure that, your surgeon knows what the risks are. So again, these things that come up, they're a low chance of happening, but when it happens to that person, it's obviously very impactful. So just knowing the risks and having faith in your surgeon and knowing where to find a reputable surgeon and one that's board certified by the American Board of Plastic Surgeons is the best place to start.
Now, you are a surgeon. If I have breast implants, how often do I need to get them refreshed? Because I feel like they're finding more and more things about older products. Like, when should you have them redone?
Sure. There's nothing, about the particular device that has a timeline. It's not like every 100,000 miles you need to get, them rotated.
Don't tell that to my husband.
But, if you're having trouble with them, sometimes as time goes on, we age. So, things happen to our body and things can happen to the implant, such as, contracture where the scar tissue stands up, or maybe some drooping of the breast. And at that point, if you're having an issue, then you would seek out a consultation.
Well, I'll come see you when mine start drooping.
They look good. Thank you so much. We really appreciate joining us.
Sure. Thanks for having me.
All right. If you want a consultation or more on Dr. Tutella's services, check out his Instagram at TutellaPS. We'll be right back with more Daily Pop.
Very informative.